Yeah, great. Well, thanks for having me. And I really don't want to take too much of anybody's time. I think it's a scary time out there for everybody, and even more so for women who are pregnant. And absolutely, as you said, it's, pregnancy is a time where everybody is so cautious about, what they eat. They're told not to lie on one side. They're told that you shouldn't eat sushi and soft cheese. So automatically, to protect the baby, a pregnant person is automatically going to think, well, I shouldn't have a vaccine. And I think, certainly in the early stages of the pandemic and last year when we did get the vaccine available for pregnant women, it was still at a point where, we were thinking that, well, pregnant women are not more likely to have complications than non-pregnant people. And so, we're discussing them very, the risks and benefits very much weighed on, is a woman going to be exposed to people who have COVID? Does she have underlying comorbidities? But that's all changed with Delta. It is very concerning that this particular variant does not, or maybe it likes pregnant women too much, because we are seeing very sick women in our ICUs, in our hospitals, and it's very different from what we experienced in the earlier waves. And I can say that the majority or all the very ill and critically ill women who have ended up in our hospitals in the Delta wave have been unvaccinated. So certainly our messaging has changed as well, because we've got increasing data that supports the safety of vaccinations in pregnancy. So although the initial clinical trials of the saltwater injection versus the vaccine were not on pregnant patients, we've had lots of follow-up data since vaccines became available last December. And we have shown no increased risk of complications, whereas we are seeing increased risk of complications with people who do get COVID. So we're not seeing increased risk of preterm birth or, small babies or babies going to NICU or birth defects or miscarriages or infertility. None of those even make biological sense, because the vaccine does not cross the placenta. It does not get into your blood. It doesn't go to the baby and doesn't harm the baby. It doesn't go into the baby's DNA. But what does go to the baby are antibodies. And so when a person receives the COVID vaccine, they develop antibodies, which are good antibodies. They cross the placenta, and these antibodies are protective. And we have, studies have demonstrated that if you test the baby's blood after birth, you can detect good levels of these antibodies. And, this leads us to believe that little babies who are vulnerable, who have not yet developed, immune systems the way that, older children have, that this is one way that we can protect vulnerable newborns for the complications of COVID. So really, as we see risk versus benefit, without question, the benefit of the vaccine is there, not just for the pregnant individual, but also for their baby. And, how do we get that information out? If you're talking to a pregnant person or a newborn, a mom of a newborn or parents of a newborn, avoid Google, Facebook, don't go to Baby Center for advice. Look at, the Center for Disease Control or SOGC, so big pregnancy organizations, because all the big pregnancy organizations are supporting vaccination in pregnancy. And if you are somebody who has had a vaccine in pregnancy, share your experience with people who may be hesitant, because I think there's so much about women who are scared and they're uncertain and they have questions. And, coming together as a community of new parents and, pregnant people to support other people through this difficult time and give, reassurance and support for these people. So I will end off there. That's my soapbox. But thanks for giving me the opportunity to share my ongoing message of, pro-vaccination for pregnancy.